Okay, hi. So, my name is Emily, and this is my project on dependent personality disorder. So, the textbook defines dependent personality disorder as individuals who are dependent on others for emotional and physical needs. People with this disorder perceive others as powerful and competent, and themselves as childlike and helpless. Obviously, this goes much further than that, so we're going to dig into it a little bit more, but that's just like the basic premises of what this disorder is. Just some quick stats. DPD is one of the 10 types of personality disorders. About 10% of adults live their lives with a personality disorder, but less than 1% of the population meets the criteria for a DPD. And women are much more prone to developing DPD than men are. Some of the characteristics of somebody with DPD would be that they're very hesitant to take on personal responsibilities, which may be as big as like starting a new job or as small as like doing your laundry or something. They have a lot of difficulty being alone, which is where difficulties in partnerships arise because they are so dependent on their friends and their loved ones, family members, boyfriends, girlfriends, partners, etc., to be that source of reassurance. And that can grow into a lot of really unhealthy dependencies in relationships. They have a really intense fear of abandonment, kind of goes along with what I was saying earlier. They're extremely sensitive to suggestions and criticism, even if it is positive, they just take it as a sign of inadequacy as like a human being. Lack of self-confidence, I put that in bold because it's really the centerpiece of what this disorder boils down to, is just a huge lack of trust in themselves and their ability to lead successful lives. They do have, like I said earlier, a lot of trouble making simple everyday decisions without a ton of reassurance from the people around them, which can be really debilitating to their individual lives. So, some common misconceptions about the disorder is that DBD is exclusive to women, which isn't true. Like I said before, a lot of women suffer from DBD and a lot more than men, but men do struggle with it as well. People with DBD only struggle in romantic contexts. It has a big part of the disorder struggling in romantic context because of the level of dependency that these people crave, but they do struggle outside of that as well in their friendships and their family. Having DBD is the same as codependency. It's definitely not. Codependency can be okay sometimes. This is, as I was describing, very like clingy and overly dependent, and they like physically cannot live without these people in their lives consistently. And lastly, that it isn't treatable. We're going to get into treatments a little bit later, but it totally is. What causes DBD? That would be abusive relationships. A lot of abusive relationships cause DBD. People who have a history of abusive relationships have a higher risk of a DBD diagnosis by a long shot. Childhood trauma also plays a substantial part. Children who have experienced child abuse, including verbal abuse or neglect, may develop dependent personality disorder. It may also affect people who experienced a life-threatening illness during childhood. So this just means that abuse as a child could lead to staying in that state of childlike dependency, especially if you did develop an illness as a child and you just never really grew out of that fear of being by yourself. Family history also plays a part. Someone with a family member who has had DBD or another anxiety disorder may be more likely to have a DBD diagnosis. And I didn't put it on here, but certain cultural and religious or family behaviors may have an impact as well. Some cultures emphasize reliance on authority, and if left unchecked, this can lead to a development in DBD, but just passivity or politeness alone is not a sign of DBD at all. So, how someone would be diagnosed with DBD? If an individual thought that maybe they would have it, they would visit a psychiatrist who would then ask them questions regarding their past mental health history, and then afterwards, they would look for 5 of the DSM-5 diagnostic criteria. And the DSM-5 is just the Diagnostic and Statistical Manual of Mental Disorders. That was a mouthful, but it's the manual used by psychiatrists to assess mental disorders. So that would be that list on the right is what they would pick and choose from. And if they had symptoms that aligned with this, that would lead them to believe that they had DPD. So these things would include an all-consuming, unrealistic fear of being abandoned, anxious or helpless feelings when being alone, an inability to manage life responsibilities without seeking help from others, problems stating an opinion out of fear or loss of support or approval, which basically means that they just have a lot of struggles with embracing their identity and being able to stand out, which is a huge part of being a human being. A strong drive to get support from others, even choosing to do unenjoyable things to get it, which is where the unhealthy relationships thing play in. A lot of people who struggle with DBD often find themselves in abusive relationships where they are being taken advantage of because they want this sense of approval so much. Trouble making everyday decisions without input or reassurance from others. Trouble starting or completing projects because of a lack of self-confidence or ability to make decisions, and the urge to seek a new relationship to provide support and approval when a close relationship ends. So yeah, once this chain of abusive relationships starts, it doesn't really ever end, which is very unfortunate. The treatment options are as follows. The most common one is CBT, which is cognitive behavioral therapy, also known as psychotherapy. And it's a structured, goal-oriented type of psychotherapy that counselors use to treat or manage mental health disorders and emotional concerns. So what would happen is like a therapist or a psychologist would help you take a close look at your thoughts and emotions, and it would kind of go with like a question and answer method. So they would ask you questions about things that you may believe about yourself, and then depending on what you answer to that, they would kind of help you change your perspective, how you view yourself. And it would be focused on building your self-confidence as a human being, because that's basically the main issue that people with this disorder struggle with. It would take place over a limited amount of sessions and can be used alone or with medication. It's just very personalized on the individual. The second option would be residential treatment, which is rehab. We all know a ton of celebrities that go to rehab. It's a very common thing. Individuals would go to a facility and receive full-time care while they're dealing with their illness or disorder. And while this works for some people, this disorder is very focused on people not being able to live on their own. So a lot of people with this disorder will kind of use this as a crutch, but like I said, it really, really just depends on the individual. A lot of people have found this to be helpful. And the last treatment option isn't really a treatment option, but a lot of people do go this route. It is the self-medication route. We all know that people drink and do drugs to help them feel more confident in themselves, and this does lead to a lot of drug abuse in people with this disorder, which is very unfortunate. But yeah, that was my presentation, and here are the resources that I used. Thank you for watching. Bye.